How often do you need to come in for treatment? Ha, I love this one. Well, I mean, if you go to a crap in-network physical therapy center and they only give you 15 to 20 minutes with the physical therapist and the rest is with a college student who's practicing because they want to learn to be a therapist, you're probably going to go in there for a lot of visits. First of all, because they want you to come in for a lot because that's how they make money. Second of all, because you're not going to get a lot of time and attention from the pro, and so therefore you're going to need more time in terms of the number of times you come in order to be with them. If you work with somebody who's cash pay like me, we're very biased that we're going to spend the entire hour, the entire time you're going to come in is going to be with us. So we're able to do a lot more because you have the professional that you're seeking out that's going to be directly working with you. Overall, most of my clients early on, we're going to work with them from 2 to 3 times a week max, usually 2 times a week max. And then after the first month, after the first 2 weeks, depending where they've kind of passed that acute stage, at that point, then we're going to move to some type of schedule that's going to be something closer to once every week or once every 2 weeks. And then we're going to schedule those out even once a month, once every 3 months as they get further into their rehab. The reality is that the homework that your physiotherapist gives you, that is going to be the number one thing that's going to help you to get better, not what you do in clinic. So going to clinic more times shouldn't be what you're relying on to get you better. What you should be relying on is you go into clinic to get those things where it's hands-on in the manual treatment and the guidance and corrections to be able to do your home routine better. And that is the purpose of it. So at one point, you're no longer going to see a change in your tissues due to manual treatments and so on. And you also are going to know your exercises and how to perform them. So therefore, you don't have to be in there all the time. You need to go in when it's time to change something, when it's time to make it more difficult, when it's time to ensure that you're doing it correctly, and so on.